I'd like to say good evening to everyone and thank you very, very much for joining us for what will be a very important discussion. We'll have a presentation and then an opportunity for participants to ask questions. My name is Keith Carson, and I have the privilege of being on the Alameda County Board of Supervisors, representing District 5, which includes the cities of Albany, Berkeley, Piedmont, Emeryville, and about a third of Oakland, including West Oakland, North Oakland, San Antonio, portions of Montclair. Tonight, we're kicking off a month-long series on various mental health topics in partnership with the Alameda County Behavioral Health and our community partners. And before I go any further, I want to thank those who work on the staff with me that have helped to put this series together, and all of the people who will be participating over the next month, those who are directly involved in mental health and others who are supporting individuals who are experiencing any form of trauma, mental health, stress, all of those things which we'll talk about. I want to acknowledge you and say thank you very much for one, taking the time to be with us, and for those who've been engaged setting up this series, a big thank you for the work that you've done. Counties in California are the mental health safety net, and we're responsible for serving not only the severely ill, mentally ill, but also we're responsible to invest in prevention and early intervention programs through the Mental Health Service Act. This series will provide introductions to a variety of topics in the mental health space, and will offer tips and tools for you to implement, as well as resources that you can go to for more information and assistance. This evening, we'll be tackling the topic of managing your mental health. For many of us, life is hard under normal circumstances. And now we've all been living through this pandemic for the past year. And if you add in financial instability, uncertainty about work, and general worry about health and well-being of you and your loved ones, it can all feel, and it is, overwhelming. As we are about to continue tonight to do our part around this pandemic, it's a good time for us to check in about our own stresses. Sometimes we're feeling, I know I am, you're feeling the mental health impacts of all of the things that are going on, the pressures and the weight that's on you and your family, not knowing what to expect the next day or even that next evening. So we will also hear from some advice and coping mechanisms for us to be able to address during this, not only this time period, but for the rest of our lives. Mental health and mental stress is not just time in a capsule, but it's ongoing. I'm very happy, and tonight we have Dr. Karyn Tribble, who is the director of the Alameda County Behavioral Health Care. She has over 25 years of experience in the behavioral health care field. In her role as the director of the Alameda County Behavioral Health, she is responsible for the oversight and provision of behavioral health and all the services that are provided. We try to provide those services in the areas of cultural ability, ethnically, and linguistically to the diverse residents that we have here in Alameda County. And we're very fortunate because we live in an area that is so reflective of the entire world. All of the, not only the ethnicities that we have, but all of the cultures and all of those issues that everybody experiences all over the world, we have them living right here. So we live in a very blessed place. Dr. Tribble holds a Bachelor of Science degree in psychology from Howard University in Washington, D.C., a master's degree in social sciences from Meyer College, and a master's degree and a doctorate of psychology degree in clinical psychology, both from the Philadelphia College of Osteopathic Medicine. And she is also a California licensed clinical worker. I want to thank you, Dr. Tribble, for taking the time. I know this is an extremely busy time, and you probably have been busy since day one of the pandemic. I know you were busy prior to that, but it's quadrupled your workload. So I just want to say thank you very much for kicking off our series this evening.
You are most welcome, and thank you, Supervisor Carson. I very much appreciate it. I'm actually humbled, and I feel honored and blessed to have been asked. And yes, we have most certainly been busy. I think I've now grown attached to my office chair here at the office, but I'm pleased, and it's an opportunity. So I will not waste too much time. And I thank you so much for the gracious introduction, and want to affirm, and I think it's a good segue into the diversity that we have here in our county and community. So hopefully what you'll hear about will be strategies that you can take away, some useful things for those that are listening. But more importantly, keep it in mind that it is a diverse community, and everything that we'll be talking about, and hopefully I'll be entertaining questions, should be seen through that lens of health equity, that we are all not created equal or in the same way. And that's actually what makes us rich in terms of this county and community. So I'm going to do my best to share my screen, and hopefully I have been successful in doing that. See if I can maybe a thumbs up, or I think
you have been successful.
It.
We can see the community mental health webinar series.
Wonderful, wonderful. So as I mentioned today, my goal again is to walk through this presentation and hopefully give you an idea of very important strategies, as I said before. So by the end of the day, hopefully my goal is that you will, whatever your experience or training is be able to recognize some important social, environmental factors, things that are affecting your well-being, because that's what today is about. And my hope is that when our team comes together each week, and hopefully you'll join us again, we'll probably build upon the strategies that we're talking about today, and hopefully there'll be some interconnection, because we know it's a very complicated topic that we hope to make it just palatable and actually very interesting and hopefully helpful. The other goal that we have is just to understand how important it is to have a holistic approach to your own care and support, and I'll unpack that momentarily. But at the end of the day, so that you'll have some basic tools to take with you. So managing your mental health, and first and foremost, recognizing the impacts of the social and environmental factors. So I want to step back, and I appreciate Supervisor Carson for laying the groundwork. What's very important is to realize everyone knows it. We've been in it for a year, and there's brighter days ahead of us. But we've been in the middle of a national health and a worldwide pandemic. With that, there clearly are job loss, income loss, insecurity, school closures, although some are reopening. It is not the same as it was a year and a half ago. Everything is different. Our social networks, how we engage people, even the questions we ask. Who knew we would have a very private healthcare questions when we meet people? For example, have you been vaccinated before I hug you? Who knew we would be here? So this is really a whole different ballgame that we're in as a community and as a shared society. And finally, in the midst of, if it were not bad enough to have the loss of health and wellness and everything else that you can put together, we are in the midst of social justice reform and political upheaval. So regardless of where you or your politics lie, you cannot look at your own mental health and well-being and not acknowledge that you want to juxtapose all these national health issues and the pandemic and what's going on in the world with how you're being affected. So the first thing, when you layer all that on top of each other, you'll see it says increased emotional dysregulation. That's just a big word for basically saying, what in the world? Your emotions used to be probably more able to be controlled, or you may be more annoyed, or you may be more happy, ironically, laughter, anxiety, depression, sadness, all of that is encompassed in that. So when you are experiencing trauma in general, and when you go through what we've all been through together, I want to reinforce together, is that it's normal to have an increased amount of inability to really regulate how you're feeling and emotions day-to-day basis. And again, if you just turn on the news and you happen to be watching what's going on in terms of trials, and a trial that's happening, and the lives that have been lost in the Asian American community, the African American community, and everyone that has been affected, it is significantly affecting our ability just to be on a basic plane with our emotions. So that's just an acknowledgement. The next one is that, as you can imagine, there's a lot of stress. We're all feeling it, and it's normal and it's appropriate. But because of the fact that this has been over a year and a half, it's what's called prolonged distress. That's not typical. So when you have a traumatic event that occurs, um, aside from really painful things such as wars and everything else, usually there's a start and then there's an end. And what we have seen is that this pandemic and all of the things that I mentioned on the left side of the screen have continued. And that's made it even more difficult for our behavioral health. And that's what the BH stands for, behavioral health, for our symptoms to really stay in check. That increased and prolonged amount of distress that our bodies and that our minds and our hearts, even if you try to ignore it, it's hard not to. And again, just to unpack that further, even if you're in the best mood and the best experience in place, going to the store is now complicated. You have to have a mask on. You can't walk through and do what you wanted to do. In some stores, you can't even go with family members. There's a limited number of people to go in. So that's what we mean by just touching every part of your life and a prolonged sense of distress, because it's very difficult to compartmentalize it. It's everywhere. The other thing you need to think about in terms of what's going on with your health and well-being right now, even if it's to a small degree, because this affects all of us, is your capacity for rapid health recovery. So what does that mean, you ask? That's a good question. It literally means, think of running a mile, and it will take you time to take deep breaths. Your muscles are a little tight. You may need to stretch. You may need to debrief. Then finally you return to normal respirations, normal breathing. You might even feel refreshed. When the stressors or the things that are happening are prolonged, it's harder for you to get back, quote, to normal, whatever that means for you. It just takes longer for you to recover. So that could be illness, that could be mood, that could be going from meeting to meeting. Before, you might have actually enjoyed a little bit going from events or things like that quickly because you had a little bit of time, or you enjoyed that adrenaline rush. But when you're going through some of these really complex experiences, your body doesn't recover quickly enough, because honestly, there's a function to that. Your body thinks it's in the middle of a crisis and it's been a prolonged set of stress. So it is normal and it's appropriate for it to be on guard. So to some degree, we probably won't experience that sense of relief, quote, whatever that looked like for you, until we at least halfway move through what we're all going through together because of the pandemic. So it's important to know that. And this one is not the funnest to acknowledge, but you're in a safe space here on this webinar, and know that it is normal and it is natural, even if you have quote a degree of wellness already, or you know family members. It is completely normal to have less of an ability to effectively problem solve, to make the rational decisions you might have considered, to really think in a complex way as you might have before. Some of you, this may not resonate, but for some of you, it just might. You might find yourself having to take a little more coffee, or take a more jog, or ask a question again, or it's just confusing. People may seem like they're quite frankly jabbering a lot and they're not getting to the point. Well, it's because, again, when you're in the middle of an event that really is a struggle for you or anyone else, your well-being is affected. So you think differently, and it is more difficult to really focus in on what needs to be focused on. So hopefully this is laying the context. Please acknowledge, or at least give yourself permission or your loved ones permission to be human, because that is exactly what this slide is about. This is what we're going through, whether it's to a small degree or a significant degree in this community. And for some people, it can be devastating, and it can be painful, and it can be life-changing. So I said a lot, and I'll take a deep breath. There's hope. There's something you can do. You still have to gain a little understanding on what that might mean for you. So let me walk you through what that means. There's what's called a holistic framework. And again, it sounds very existential. I don't mean to sound that way. But what it just literally means, think of a whole person. As some of you may remember, whole person care is an endeavor that our county went through, AC3. There's all these great things that really looks holistically. And I'll break that down specifically. It just means looking at the biopsychosocial, and I'm going to add spiritual component to how you are functioning now. You probably have heard lots of times about biopsychosocial model, or for those, are you just holistic, or, you know, you think of alternative medicine. I don't even mean it to be that complicated. It literally means looking at how you're doing or your loved one is doing from a very basic biological perspective. Do they have the medical care they need? Do they have food? Do they have clothing, shelter? What many of us forget, exercise. Are we getting enough? I halfway joked in the beginning about this becoming my permanent chair, but I've had to go to Costco and buy 2 pillows for my chair because my body is just not used to not to being as active as it normally is. So you have to think of how you're taking care of yourself, and in turn, how others may be experiencing, especially if you have loved ones, and many of us do, people that we care about. Think of whether they're getting their biological, their bio needs met. Then the psychological piece. And as you can see, it talks about mental health and substance abuse. And for those that aren't familiar, when we say behavioral health, that's what we're talking about. We're talking about an integrated both mental health and both substance abuse. And then think of, do you need crisis support? Is your care being coordinated? Meaning, do you know whom you should call? What's going on for me? How am I thinking? How am I feeling right now? Am I, as I mentioned before, am I drinking more coffee? No need to disclose, but am I smoking more cigarettes than I used to? Or am I taking more than 1 or 2 or 3 glasses of wine? Or what's going on for me psychologically or experience-wise in terms of how I'm functioning right now? It's very important that you attend to both, because in some cases, believe it or not, maybe I need a little protein, or maybe I need a little potassium. So I'll take a banana and I'll eat a sausage or something else, and I feel a little better. That in and of itself is able to help me maybe cope a little differently in terms of the psychological portion of it. So that's why this framework is, think of a table, having all 4 legs firmly planted and attended to gives you the strongest ability to be resilient. The third component, and this is the hard one, because I said in the beginning, the pandemic has forced us to disengage from many of the people or the groups or individuals around us that really gave us that great contact, that helped us to feel safe and secure, literally, that we bowled with, that we played with, that we prayed with. All of that is different now. Although we're getting back to where we need to, if you've watched television or even yourself have experienced that guilty pleasure of doing something that you don't think you may want to do because we're in the pandemic, it comes from a place of a really human need to have some kind of contact or interaction with others around us. Some introverts may be fine, but for many of us, you need and crave that human connection. So it could be anything. And because of the pandemic, I certainly want to underscore our health officer orders and the processes that we're going through, and safe distancing and certainly being vaccinated. But keep in mind, whether you're still at home or you haven't had a chance to partake for your vaccine, if you so choose to obtain. But think of, do you have enough social connection? Have you done what you need to do to connect with others? Are there things you're wishing that you had? There's so many great platforms now, media-wise. You can watch TV together if you had to on a TV screen. I haven't mastered that myself, but I hear it exists. But there's so many other things besides getting together. And there's getting together. There's going to the park, taking a walk, but connecting and talking. That's really important. And each of us really need to look at to what degree we need that in that moment and what is helpful to us. And of course, in the middle of a pandemic, how we can get our social needs met. It's really important to think of that. And the last one, this is often, especially in many diverse communities such as ours, can cause people a lot of consternation. Oh, what does she mean by spiritual? So first and foremost, this is not an attempt to proselytize at all. I happen to be a person of faith and background, but for you, whomever that is, or a loved one, it just might mean existentially as a person, what do I believe? What do I think? How do I feel about myself in this world? And what gives my life purpose and meaning? That is extremely, again, important. That's the 4th leg of a holistic approach that you should consider in managing your own mental health, because what many people are forgetting, they're getting the basic needs met, but then they forget that there's some self-disclosure, there's some self-look, and there's faith, and there's belief, and there's connectedness. It could even mean a political affiliation. It could even mean advocacy. And so you'll see, especially now, people are trying to seek out those things that made them feel purposeful and gave their life meaning. And it's just as important to you, whatever that looks like for you. It's extremely important to really nurture both your body, your mind, and yourself socially, but also spiritually, who you are as a human being on this earth. That is the fourth leg, essentially, of that foundational holistic framework. So keep that in mind. So what does all this mean? Again, I said a lot, so I'm gonna slow down and take a deep breath. There's things that you can do concretely besides, as I mentioned, recognizing that framework that is helpful. Before I go there, though, I want to say that I liken this to thinking of, for those of you that take planes and have flown on a plane, if you remember in the beginning where the people on the plane that are the stewardess or steward or whomever to help facilitate you being introduced to the safety features, we'll talk about putting a mask over your face. And i.e., if you have children or young people or more vulnerable adults, they'll tell us to first get the oxygen affixed to your face and breathe before you help others. And although many of us want to be martyrs and would do anything for people who we love or care about and will jump right in there, the reason why that's important, it goes back to that whole decreased ability to do decision-making on the respirations and everything else you need to do to function, and biology, what that means for our coping. Unless you take care of yourself initially, and I don't mean by self-care meaning getting a massage per se, that could be, I mean literally making sure those fundamental four corners of that table are taken care of. It is very difficult for you to render good care to anyone else. And in fact, because of those four things that I mentioned initially, decreased problem solving, difficult to manage it, and prolonged distress and trauma, you're not as even effective, quite frankly. So here's some tools to think about. And there, I don't know who that is, so there's the shout out to whomever that is from the internet. So hopefully they don't come after me for publishing rights. But it's a great picture and image that I hope to leave you with, that you should apply that oxygen mask to yourself. And here's ways and things to think about concretely of what that might be for you. First and foremost, you want to limit, especially now, prolonged exposure to distress. That could be media, personal activity, vicarious traumatization. That means a trauma or traumatic experience that you may not have experienced directly, but someone else has. And it may be a variety of ways that you become exposed to that. It's important to limit that, especially now. We're not yet through the pandemic, and there's a lot of stressors. Our life, our job, our work, everything is different. You're going to have to titrate it down, in my opinion, and our experience, in order to really give yourself the optimal ability to cope. So many of us are, again, following what we're seeing. This is the Bay Area, and there's a lot of advocacy or watching, i.e. the media in relation to the George Floyd trial. Regardless of how you feel, one has to be very cognizant and clear of, i.e. looking at those type of images and listening to that, because it depends on where we are in that particular moment and our walk in terms of our health and wellness. And know and tell yourself that it is okay to limit that. It is okay to find out what is important to find out about from a personal exchange with a family member, but it is okay. At the end of the day, the bottom line is that you'll be in a position to be more of support to others if you understand what your top or your ceiling is for that moment. The second one I love, employ in recharging activities. And that means just whatever that means. It means if you enjoy something that gives you pleasure and rest or peace, whatever that is, whatever makes you feel like, you've cracked your knuckles and you're ready to go out and do it again, do it. And make sure you commit to identifying what that could be for you. Some people can't help but notice, yes, I'm a sci-fi fan, and that is Baby Yoda or Grogu, as my daughter often corrects me, and I've got another one hidden around my office somewhere. For us, it's Sci-Fi Channel. It is the sci-fi movies. We can't necessarily go and enjoy. There's 6 of us in our home. But my husband and I will make sure, whether our young people are 20-something to 9, that because that's our thing, we will find the most strange zombie apocalypse movie. We have prepared and packed, and we have fun. So whatever that is for you, it's important that you take time and think about what it could look like for you and make sure you do it. It is, again, it may or may not be going to get a massage or getting your nails done or your hair cut or golf. It may not be that complicated because, again, we do have pandemic and things to think about. But if you can do it, I would encourage you to think how to do it safely, to refill your cup, because a lot of people's cups, quote, are running empty these days. The second thing I think is extremely important is identify what's a must do and what's a should do, and then prioritize and forgive. What does that mean? A lot of us try to stay focused by creating lists, or literally in our mind, I must do this, or I should do this. I should clean my house. I should do this. I should work. I should do all these projects. I should make this presentation. You really should be very careful what is really something that is a must versus something that is a should. Something that's a should, you can probably put aside for now. If it's not an emergent issue, your body and your mind's going to want to do all these great things. In one moment, again, we're trying to recharge ourselves to get back to a sense of normalcy and accomplishment because of what the pandemic has done. But I would advise, because of all the reasons and the things that I've said earlier, to take your time with that and prioritize. And then at the end of the day, forgive just means that if you didn't do it, if you didn't clean your house from top to bottom, or you didn't build that shed overnight, it is okay. It will be there tomorrow, and there are things that you can do in the meantime. But that's what that is about, just a sense of forgiveness. The last two are important about coping just on a day-to-day basis. I don't think it's requires much explanation. Don't sweat the small stuff. So we will say it as plainly as we can. You will find, and it goes back to, it is our mind and our body's desire to create order, to organize, to understand. You might find there's something that it just gets your goat. I can't think of a more common term, but hopefully people know what I mean. You just have to do it, or you must do it, or that person just irks you, or some event occurs and you must fix it. If you can take a deep breath and breathe and let it wait for a minute. I use a euphemism. You want to send that email, save it in draft, and let it sit there for a while. Because at the end of the day, because of all those things I mentioned, you may realize that it's not that big of a deal. And that is not enough for you to spend a lot of emotional and psychological and spiritual energy on something that will not help you at the end of the day to cope and to maintain your own mental health. So again, don't sweat the small stuff. And the last one, again, just makes everything real. Commit to some timeouts for yourself. And as I mentioned before, there's those recharging activities that help you feel energized and excited, but there's also needs to be a time for rest, whatever that looks like, relaxation, and for you to actually just kind of process and get ready for the next phase of a meeting, of an event with your family. It could be if you are in a healthcare capacity, treating your patient or your clients, but most importantly, it's just taking time out to be in a place to continue in a healthy way. So you do have to give yourself a good time out, not a negative one. And finally, as I start to close the presentation, here just are some strategies that you can use, especially when there are loved ones around you. I use this acronym ART. I don't think I made it up. It's just been something for the last 25 years. I was a director of training back east and happened to help people with crisis management. But I'm taking it into the context of a crisis. And I think it's something that it's helpful to people to remember. Think of ART, and A is the assess. Think about who, when, what, where, and how, just basically what's going on. So when you see someone struggling, if you really want to be a support, whether they're a child or an adult or an older adult, a caregiver, family member, whoever that is, take a step back and get a better sense of what's happening for them. As I mentioned earlier, when I mentioned don't sweat the small stuff, you might again have a loved one or coworker or a person come into your office or come into your space and say, I'm upset about blah, or I don't want to wear my mask. This is blah, I'm just angry and upset. If you take a step back, there may be way more things going on for them in the moment. And if you can pause, i.e. put the email in draft, you'll have a better sense of what may be helpful to support them. If it gets to the point where things are really complicated, and again, this is a step shy of crisis, because we certainly would want people to feel that they can avail themselves of mobile crisis and support. And I do know in the series later, I believe on the 22nd, there will be a topic around crisis specifically, but you can do something in the moment. You can be supportive. You can normalize what they're saying. You can give them choices. If a person feels that they're disempowered, you don't have to argue with them and say, well, you can't do that. You can think again in your earlier assessment and say, clearly you're upset. How can I help you? What can we do? You said you didn't want to, even if your kids, you don't want to eat your peas, or you hate Brussels sprouts, and you think that apricots are food for the devil. Okay, is there something else you might be willing to eat instead of those things? Because we have many options here on the table. That in and of itself can give a person a sense of empowerment and actually have them feel as though you've heard them. Normalizing whatever they're going through, and not in a patronizing way, and not in a way where you tell them what they need, but literally maybe redirect them in a sense of, is there something else that can be done? That's the hope. That is the option that you can help to impart to people when they're struggling in many cases. And finally, teach and empower. This one I love, because we who are parents and other people, or even caregivers or to our adult parents, sometimes begin to do the teaching before we should. So I have images of a finger wag sometimes, and it doesn't always go well, and it actually makes it worse. As I mentioned before, we all need time to recalibrate. And when people are going through something and you may be trying to intervene, you actually have to enable them to get to a place where they can hear you. They have breathed, they are calm, or they're able to feel as though you've heard them. And sometimes it may not be right there in the moment. It may be when time has passed, things are calm, things have subsided, but it's really talking through how you can be of a support to them, or the things that in the future can be done differently. That's really when you have the impact, when their mind is clear enough to hear it. Certainly not 6 weeks down the road. That's a little passive aggressive. But if you can wait till a situation has been diffused, that's where the redirection comes, then they'll be able to really put the pieces together themselves. And this could be for yourself too. You could try to do this on your own. I've never tried it, but I'm sure that you certainly can be. But that's really if you want to have long-lasting change and success with really managing some really complicated events, it really helps to do the teaching and empowering them to make different choices if they can, once things have resolved, or at least once it is calm and they're able to hear you. So as we wrap up, this slide before the end slide is, at the end of the day, these are just really concrete ways for you to navigate. If you forget, i.e., what in the world did Dr. Tribble say? What was that acronym? Was it ARF? Was it ALF from the 80s? Was it the movie? What did she say? If you don't remember, it's okay. Just ask and listen. And don't be afraid to ask direct questions. And I put this out there because, there are many of us, and it is true, we have seen a rise in people feeling hopeless, and in many cases, looking at self-harm as an option, and even succumbing to some things. That is on the rise. It is national, and we have seen it is actually worldwide, and that's pain. So even if you don't experience or see anyone suffering that level of difficulty, even if they're going through something, ask and just listen. Sometimes if you don't know the answers, just ask, just hear it, get clarification, because remember that with the pandemic, it has made us disconnected, and that feeling of being heard and listened to can be just in a genuine way, that is, it can be very, very, very supportive to someone going through this. And again, that stigma and secrecy, so not asking the questions, is what is more difficult and could be damaging than asking them. Putting them out there doesn't mean you've created some issue or crisis. It just means that you have heard them enough to react to what they've said. That's respectful, and it actually can be very helpful. And because we don't want you to feel alone, there's always professional help and resources. The county's here, crisis services, 911 is here in this county, regardless of what you think of 911 or whatever your mind goes to when you think of that. We do have teams, including crisis, which you'll hear more about it, crisis teams who come out. They can help along with law enforcement. They can help by themselves. They can give you feedback over the phone. And there's many other people in your life that I'm sure may be a professional help or a resource to you. But it's really important that unless you're the expert or trained, you can definitely do a baton handoff. But in the moment, anyone has the capacity to just be a support as long as it's safe. And finally, at the end of the day, hopefully you remember some of the things that were said, and we hope that you find it helpful. Just keeping in mind that behavioral health recovery is a journey. Whatever the issue is, whatever the healing that you need, it takes time. And unlike a headache for our medical providers and our partners and sisters and brothers, and we have nurses and physicians in our department, regardless of the ability to find something can be cured, mental health is not like that. It's a little more ambiguous, as you can imagine. And it's a lifelong journey, because each day that you feel something, you learn toward the next one. So be patient with yourself, your loved one, or whomever else you're being a support to. We think that's the takeaway item in terms of really figuring out how to normalize it and really think of the trauma as something that may be lifelong, or at least for an extenuated amount of time. So hopefully you've taken away some really concrete things, realizing that we are going through something that, again, in my home, they call it the zombie apocalypse. No disrespect intended, but it's the way that, as I said, my young adults and young people in my home have held to acknowledge that this is not a normal time for many of us, and our mental health is important. There's a lot of health and cultural things that are happening to us. And if you forget everything else, there's an image there. Take a note to remember the table leg. Just write yourself a note to remember your biopsychosocial and spiritual self, who you are, what you need on a physical level, your mental health, your psychology, the way you're thinking, and socially, are you getting your needs met? It's really important to maintain your sense of wellness. And as I said, there's a few steps that you can use. That acronym ART: assess, redirect, and teach, and empower, hopefully. And at the end of the day, asking and listening, making a baton handoff to other people, and giving yourself permission and acknowledgement that recovery is a journey. So that's the presentation that I have, and I will stop sharing. And I certainly hope that it's been useful or maybe prompted some questions or comments. And I'm going to try my hardest to stop sharing, and I think I did. So thank you for your attention.
Thank you very much for that presentation. I'm going to ask that Amy direct the questions over the next few minutes, but that was an incredible presentation, and I took notes just like if I was in school, let me tell you. Very valuable. I hope to review my notes occasionally as I feel the stress and strain of life.
Please do. Please do.
Amy.
So we will take questions. You can raise your hand if you'd like to ask a question live, or you can put your questions in the Q&A box. And if you're on your phone, you can press *6 to unmute yourself to ask a question. So if you'd like to ask a question live, you can raise your hand and we'll unmute you to ask your question. First, I'll ask some of the questions in the Q&A to Dr. Tribble. So what does help look like if someone doesn't have health insurance?
That's a wonderful question. So I not to be self-centered, but it could look like us. It could look like County Behavioral Health. That's really what we're here to do. People who are uninsured, you can give us a call, and what our team will do is assess whether what they're going through is really severe, long-term, life-changing, or if it's something that may be more mild to moderate. And either way, we try to connect you and give people the right resources. Our crisis teams don't care. And we don't care to one degree, but if a person's in crisis and you need help and you call us, we respond. We will not ask people whether they're insured, whether they're not. And at the end of the day, there are lots of programs. We happen to be in contract with some really great providers, healthcare centers, federally qualified health centers, community programs, faith-based organizations. So there's something out there. So even if people reach and call and connect, we're here to help. And I have to admit, sometimes I get random emails, and I myself will make sure we hand it off and get support. So health insurance is actually not even a requirement at all to get the help you need, especially these days. We're here.
Thank you, Dr. Tribble. And we will share the slides with everyone who's registered, and the video will be posted on our YouTube after the presentation. So I'm going to, our next question is from Sylvia Bonilla. If you would unmute your mic to ask your question.
Yeah, thank you very much. This is wonderful information. Dr. Tribble, I really took notes. I was writing real fast. My question is, when we are talking the holistic way, if you can give me like an example of how can you help somebody socially speaking when they isolate themselves and they don't have a lot of friends, they don't have family. How can I help somebody?
That is a fantastic question. And I will try not to use a lot of jargon that's not helpful. If you remember that ART, the acronym ASSESS, it's literally you're looking at the function of the isolation. In other words, trying to figure out why are they isolating. Some people isolate because they're introverts. So if you actually said, let's go to Walmart, they're like, no, I don't want to go to Walmart. And that's okay, as long as they're still healthy and able. But you have to look, if you can, on a very basic level, is if they're doing something socially where they're isolating, is there embarrassment? Is there hopelessness? Are they an introvert? Do they have they looked in the mirror and gained pounds? I mean, there could be so many different reasons why. They could also experience, again, I don't want to say a lot of jargon, but there's a thing in behavioral health that just means you just don't take pleasure in things that you used to take pleasure in doing. So if you know what, you don't have to be, a clinician with a whole bunch of degrees at the end of your name to do that, but it's just trying to ask them, asking, I noticed you like to be at home a lot. Tell me about that. I won't say why, because why often is that it makes people on the defensive, but just tell me what you're going through. I want to be here to help you. And if they say things like, you know what, I really don't want to be bothered, people just overwhelm me or whatever it is. Again, as I mentioned, there are different ways that they can get their needs met socially. If it looks like it's unhealthy, then we we recommend outreach teams, and we have services, for example, for us in older adults, that sometimes it just becomes easier. Their world gets a little small, they're smaller, and before you know it, they're isolating. So if you can, in your own way, find out why they're isolating, again, not using the word why, but maybe what's going on for you, it might be helpful, because everyone's going to maybe need something different to make them feel connected. And again, it may be as easy as they actually may prefer, and I know I have some young people and family members who will actually prefer to have a whole community online. We just don't see them engaging. And if they're getting their needs met, we should honor that as long as it remains healthy, and as long as they're getting their food and clothing and their shelter and everything else met. So I think that's the first step, to really get a sense of why that behavior may be occurring.
So next, our question is from Anton Hicks. Anton Hicks.
May have to help.
Please unmute your mic, Anton Hicks.
I do not have a question. I'm sorry.
Okay, no problem. Do we have any other questions? Again, you can put them in the chat or raise your hand, and I can unmute you to speak. see. Books. Next question is from Cheryl Davila.
Thank you. I was just curious. Thank you for this presentation. It's been great. But I was curious, domestic violence is on the rise, and I was just wanted to relate that and see how that's being handled within Alameda County and the mental health department.
That is a astute statement. You're absolutely right. At the start of the pandemic, and I believe our social services partners also did a presentation acknowledging that the numbers of elder abuse, as well as child abuse and domestic violence calls and claims were going down. And if you just looked at it at face value, you'd say, yay, but that's actually not good, because what it meant, as you're suggesting, is that the normal way that people would also even report, or even that it would come to the attention, i.e. for teachers and others, were not there. So we have, what we did specifically, and our social services, I won't speak for them, but they really had done a lot of work in their own right. But what we have done is early on, we basically dispatched our consumers, our peers, our family members. So in other words, we did a lot of outreach, and we certainly set up ways for people to have telehealth, or, connect with clinicians and people by video and other phone devices. But we actually changed and pivoted and said, we want actually to enlist just regular people who have a commitment and maybe working as peers in our other organizations or in our system. And they just did calls. They just said, hey, you need a burger? Again, biopsychosocial, look at the 4-prong. They would get their foot in the door. And then in many cases, we found that we were able to be a support. But again, if you thought of that, the model that I mentioned before, for domestic violence, as everyone can imagine, it's very insidious and it's very difficult, and you have to be very artful with it. So if people, I would say my first advice is if people believe that that's an issue, oftentimes a safe space to a safe space that doesn't really give indication that there may be something going on could be a medical appointment, a hospital. People are going to get their vaccine. So if there is an instance of that, you can go get your vaccine and you can actually report, and they are there to help you. So there's a lot of different ways that, in a savvy way, that people can access care. But for us, we just did it however we could. And there were cases where we saw that people weren't able to tell us outright. So by using other opportunities, social, again, hey, you want to come and do this, or can we do this? We'll give you some food. We were able to find, and I would think that our social services partners were able to see the same thing. But I think just thinking creatively, number one, giving them a way to reach out for help in a safe space, is preferred at this point. And we found that that's been helpful. But again, one can take advantage of what people are doing now in terms of seeking care at a healthcare facility, because again, they will often have signs posted, if you need help, let us know, or you can wink, or you can make a note, you can do, and the person can write something on their admission form that can be a signal. There's a lot of ways that people can get the help they need.
Oh yeah, our next question is in the chat. It is there a website to go for mental health resources?
There are lots of websites. Actually, what I will try to do, I'm sorry I don't have them available, the state has actually set up a phone number. And what they have done, and I don't want to say, there's certainly resources here locally, but what the state has been crafty in doing is pooling a lot of different resources all over the place, because there's actually, there are federal lines, there's state phone call lines, there's local lines, there's us. And so there are lots of different resources. On our mental health website, I think the first thing to do, certainly people can come to us directly, call our access line. That's the portal. But again, there's lots of numbers, and I certainly will make sure we have that available for Supervisor Carson's office. And I apologize, I don't have that with me. But there are definitely more resources out there, and they've been very creative with creating them.
We have our next question came in. Are there providers within the Alameda County Behavioral Health Network who offer evidence-based treatments for individuals suffering with symptoms of PTSD other than regular talk therapy, and how would they find them?
Yes. So what I'll say is that it is an art form to have a specialty service that you do, including with trauma. But most of our providers are able to provide, and or we have a relationship with many providers that are skilled in non just talk therapy. And in fact, I'll be frank, for our county, certainly counseling is important, but we tend to be very pragmatic in the types of services we provide. So it's not just therapy, it may be other type of things that they do. So we do have providers. If people do have a need for that, it's important to, when you call, to be specific, whomever that is, whether it's county or not, to say what you just said, that I have experience with trauma and I'm wondering, are there alternatives? Because we do, besides psychopharmacology, medication, obviously, some people are interested in different modalities, physical techniques, relaxation techniques. There's different type of holistic healing that many people feel like they relieve trauma. Again, there's EMDR. There's a lot of different specific practitioners that will do it. And we also, besides having organizations at our disposal, we literally have licensed practitioners who are on contract with us. And primarily for those who have Medi-Cal or underinsured, you can call and just say, I want to talk to a clinician and I'm hoping they have a specialty in blah. And we will literally, because we're technically an HMO of sorts, we will give people a list of resources, and they are free once they're able to get that information to choose whomever, and they can actually find the best fit for them.
So I put the number in the chat, but the number to the California Peer Run Warm Line is
Yes, thank you.
1-855-845-7415. That's 1-855-845-7415. And that's the California Peer Run Warm Line. If you have questions, please raise your hand to ask them live, or you can put them in the chat or the question and answer box, and I can ask them to Dr. Tribble for you. We have a few more minutes. Any last questions for Dr. Tribble? All right, it looks like that was it for questions. Thank you so much, Dr. Tribble. I also see that someone shared the provider directory for ACBH in the chat, so thank you for that. And we'll share those links when we share the presentation and the link to the video. So Supervisor Carson.
One of the things is we're not in this alone. Whenever you're feeling any anxiety, stress, you're experiencing emotional trauma, you're having some thoughts and not knowing where you are or what's going on. We're not in this alone. And there's all kinds of help for us that are out there. And let me just say in full disclosure, I, a few years back, even spent 1.5 years with a therapist. And I could say it was the best experience that I've ever had, the ability to sit down with someone who is trained and a professional and able to observe and be able to give me some thoughts and critique and kind of help me guide through the anxiety and the ups and downs that all of us experience each and every day, regardless as to whether it's subtle or is more pronounced, whether or not it's someone else telling us, well, I'm observing something, or you're feeling some anxiety yourself. I mean, just to check in with someone else, and especially if they have your best interest at heart, is very important, because we live in a very complex world, and there's a lot of different things that impact us all day long, every single day. And just containing that information, holding it in, and not sharing your observations maybe with someone else is not necessarily doing the best for yourself or them. And so keep that in mind. We're not in this alone. There's all kind of support services that are out there. And as we heard Dr. Tribble, there are things you can do on your own. Find that place that gives you a break from the day consistently to some extent. Find that aha moment, or breathe in deeply and breathe out and control your breathing for a little while. Get a little bit more rest. Take some time off from the conventional things that you do. And again, there are all kind of help aids that are out there, and no one should feel inhibited or fearful or resistant about reaching out for professional services or for someone else to assist you as you're experiencing these things of bewilderment and confusion, or not necessarily knowing whether or not things are what you see them as being. I want to thank Dr. Tribble for sharing her time with us and providing such great information. I'm sure that people will digest this information, reflect on it. Not everybody is willing to jump out there and say, oh, I'm experiencing this, or wow, kind of think of going through these things alone. We don't want other people to look at us differently, or we don't want to expose our frailties. And as a result of that, it might take a little time to resonate and to digest the information that we heard today. But the good thing is, this is a series, and we're going to have several more opportunities for you to follow us on some important topics. We're trying to make sure that our series reaches everyone. There's something that's important for the youth. There's something important for those who are seniors, those of us who are just not sure where things are. And so there's opportunities for you to follow this series, share this series, and for those who want to check out this recording again and go back and pick up this information like I did with my pen. We're posting it on my office's YouTube channel, which can be found by searching Keith Carson District 5 on YouTube. So I would encourage you to do that. And again, you can go online and check out all kinds of opportunities to talk about anything dealing with mental health, mental wellness. Again, thank you to Dr. Tribble. I want to say thank you to Amy and the staff for setting this up. More importantly, I want to say thank you to all of you who took the time to just open up and see what this is all about. And we hope that you'll share this series with your friends and loved ones, or even people you don't necessarily care for. Share it with them as well. With that, we look forward to seeing you the next week series. Thank you again, Dr. Tribble. Really appreciate it.
Thank you. Thank you so much. I appreciate the opportunity. Be well, everyone. Thanks again.